Hi, you're listening to the Baby Manual podcast, the podcast that helps you feel confident as a new parent. I'm your host, a pediatrician and mom, and the author of the Baby Manual, Dr. Carole Keim. Hey, and welcome to episode 4. This is for when your baby is 1 month old. If your baby's around a month, this episode's for you. As parents, you should start to finally be feeling in the groove of things. You're starting to notice patterns a little bit. You might be getting a little bit more sleep at night because your baby has their nights and days figured out. And when they wake up at night, it's just all business. You just eat, change their diaper, and then they go back to sleep. Babies just are usually awake during the day at this time, but can get overstimulated pretty easily. So you don't need to keep your baby busy or entertained. Really, just looking at any kind of shapes or lights are really fascinating at this age. They're starting to notice their toys a little bit more, starting to hold them and put them in their mouths sometimes, or just shake them around. That's plenty of stimulation for them. You can still narrate your day, so just talk about what you're doing as you're doing it. And you can try babbling to your baby and making faces at them and see if they try to mimic anything back. Usually around a month is when they start smiling, and it's just so sweet. I just love this age. And typically they're cooing. They're not making any real babbling sounds yet, but they do coo. Now that they're a month old, as parents, if you haven't had a date night yet, this is a good time or about when parents start to think about their relationship again. So I know baby's been sucking up pretty much all of your time and energy for the last month. So now let's try to find a time for a date night so that you guys can connect. And a lot of parents at this age will just take their baby with them. They have to eat so frequently anyway. And babies tend to actually fall asleep when they get overstimulated in environments like at a restaurant. So, if you did take them out, make sure it's nothing too loud, but the white noise in a restaurant can sometimes put them to sleep. For eating, at this age, they should be feeding 8 to 10 times per 24 hours. They're starting to consolidate their feeds a little bit more. So rather than every 2 to 3 hours, they sometimes can go as long as 4 to 6 hours between feeds. Actually, you shouldn't let them go more than 4 hours, but they might not seem very hungry even if it's been 4 hours. You should still try to wake them up and feed them though. They're eating 24 to 30 ounces approximately per 24 hours. So if you're making formula or giving expressed breast milk, they should be in that range of 24 to 30 ounces. And they should still be gaining about half an ounce to an ounce a day. In terms of peeing and pooping, this is the peak age for discoordinate stooling. So a lot of babies at 1 month are starting to go through a phase where they're learning how to control their muscles to poop. So what they do is they squeeze their abdominal muscles really tight, and then they squeeze their anal sphincter closed, and nothing comes out because they're just building up all this pressure. They turn red, they grunt, they cry, they look miserable, and nothing comes out. And so parents all tell me at this age that their baby is constipated. They're not actually constipated. They're just learning how to poop, because when that poop finally does come out, and it could be as much as a week later, it's going to be nice and soft. And if it's been several days like that, it's probably going to be a blowout as well. So you want to start keeping extra clothes, not just for baby, but an extra shirt for yourself as well in the diaper bag at this age. With discoordinate stooling, there's really nothing you can do to help them through this phase. They will get over it with time, and you just have to let it pass. You should not be giving them any medicines. Do not give them prune juice. Do not put anything in their bottom like suppositories or thermometers or things like that. There's no need to give them any help because they will figure it out. And if you do anything like that, it can actually make it take longer for them, and they can have problems with severe constipation later in life. So you unfortunately just have to let them get through it. And this phase typically lasts 2 or 3 weeks, sometimes a little more, sometimes a little less. And it can be really hard on the parents, but just realize they will get through it. It will pass. It's normal. For gas and colic, this is peak age for gas and colic and reflux showing up and being really severe. So for gas and colic, what you can do are belly rubs in a clockwise direction, up and downs with the legs, bicycle legs, like they're pedaling a bike in midair, or you can hold them face down in your arms like a tiger in a tree, where you've got your hand on their belly and their little arms and legs are hanging down from your arm. And their head is resting kind of in the crook of your elbow there. That position can help. And also even just tummy time on the floor can help with gas, can help the pressure on their belly helps the gas to pass. You can do simethicone drops. Simethicone is a medication that's not absorbed at all. It's called Baby Gas X or something similar. And what it does is it breaks large gas bubbles into smaller gas bubbles. So simethicone doesn't start working until it's all the way down in the intestines, which means you need to give it several hours to start working. And I suggest giving it at least 4 feeds in a row to decide if it's going to work. So right before baby eats, you use that little dropper it comes with, fill it up to that first line or whatever is appropriate for their weight. Give them that whole dropper full right before they eat, then feed them 4 times in a row, and then decide if it's helping or not. And it should help with that gas. Probiotics are the one thing that have been shown in studies to actually help with colic symptoms. So any probiotic is good. You can do any baby probiotic, anything that's liquid, comes in a dropper. You can mix it in with their food or you can give it to them before they eat. For signs of severe reflux, if baby is losing weight or not gaining enough weight, or if they're spitting up more than half of their feeds, if they're arching their back and screaming, or if they're aspirating, like if they're choking, coughing, or sputtering, those are signs that their reflux is severe and probably does need some treatment. So talk to your doctor about that. But most cases of reflux don't need treatment. It's normal for babies to have physiologic reflux, which means their sphincter between the esophagus and stomach isn't fully formed until 6 to 12 months of age. So it's normal that a little bit of stomach contents will reflux up now and then. But if they have signs of severe reflux, talk to your doctor. Those medications do have some risks. We're seeing that in the long term, it can increase their risk of getting fracture or broken bone later in life. It kind of causes thinning of the bones, sort of like osteoporosis, but a little bit differently. So that there is that risk factor over time. But hey, if your baby needs it to gain weight and to survive, they need it. So you talk to your doctor and ask if they really need it or not. Pyloric stenosis is a medical condition that requires a surgery, and that shows up around this time as well. The pylorus is the muscle between the stomach and the intestines, so it allows food out of the stomach to go into the intestines and get digested. Some babies around a month of age, their pylorus grows too big, and as it grows, that muscle gets thicker and thicker and starts to block off the tube between the stomach and the intestine. And so it just kind of crunches it down because it's a big muscle. So the only actual treatment for this is a surgery where it's a very, very small surgery, minimally invasive. The surgeon will make an incision that's about 1 inch long, go in and just make a little slit in that muscle that will open it up and allow food to pass again. With pyloric stenosis, the signs that you might notice at home is that baby is spitting up more and more. It starts to be with every feed, and it starts to be greater and greater volume over time. Also, if the vomit ever turns green, if like a grass green or grass stain kind of a color, that is bile, and that's a sign of a blockage, probably pyloric stenosis. So those are reasons to seek help from your doctor. Also, projectile vomiting. So a lot of parents will use this word, but what it really means is very forceful vomiting. Normal spit ups can be forceful because they can have an air bubble behind them, and as baby burps it up, it might go flying out. But with pyloric stenosis and with true projectile vomiting, there's a big arching movement of baby's whole body. You see their stomach contract. A lot of times there will be some noise associated with it, that blah kind of sound like when adults vomit. And it will typically shoot pretty far, like 2 feet or more. So that is true projectile vomiting, and that is also a sign of pyloric stenosis. But even just spitting up more and more with every single feed could be a sign. So talk to your doctor if that's starting to happen. The treatment at home for reflux before we get into the medications is to give them smaller and more frequent feeds, hold them upright for 20 to 30 minutes after feeding. That can use gravity to kind of keep the food down in their stomach, and have them sleeping in a reclined position, either by putting something like a textbook or a phone book, if they still make those, I don't know, something like that, just a cup like 2 to 3 inches high under one edge of the crib or bassinet legs, like on the floor. So it tilts the whole thing up. You don't want anything inside the crib or bassinet, nothing under the mattress, no pillows until they're 2 years old, actually. So just something to tilt the whole crib or bassinet can help them and can help use gravity. Now, if they have pyloric stenosis, these things won't help. They won't make a difference. So you're not going to mask it by doing this. So it's totally okay to try these things at home to see if it's reflux. And the other thing with pyloric stenosis I forgot to mention is that if they are ravenously hungry after they spit up, that's another sign, because there's nothing getting from their, or very little, progressively less over time, getting from their stomach into their intestines and getting absorbed. So they are actually eating not enough or not getting enough nutrients. And so they will be super hungry after they spit up. With typical normal reflux, they won't be. They just spit up sometimes because they ate too much. And so they're usually pretty full. For skincare at this age, a lot of babies are starting to have their soft baby skin, but you might be seeing baby acne around a month of age. And that's a normal thing that will go away. Some moms say that they can put breast milk on it. It helps a little bit. I don't know personally whether that actually helps, or I haven't found any studies on it, but you could try it. But basically what we tell you is just to leave that skin alone and let it get used to, being on the outside, get used to the hormone shifts of being outside of mom's body. And you only want to bathe your baby once or twice a week so you're not over drying their skin. And you can use a regular unscented baby lotion or cream or ointment after the bath to keep that moisture sealed into their skin. For diaper rash, we do see a lot of diaper rash around a month of age. Diaper rash is pretty common and happens to just about every baby at least some point. And a lot of those will also get infected or colonized with either a yeast like Candida or a bacteria like staph. So for your diaper rash, if you see a diaper rash, initially what you want to do is start with some barrier cream, something like zinc-based like Desitin, regular strength, or something petroleum-based like Vaseline, Aquaphor, or A&D ointment. Those are things that will just seal off moisture from the outside of the skin. So when the baby pees again, it's not going to irritate that rash, and they allow the skin to heal from the bottom layers up. So it takes a couple of days typically for it to heal, but you should see it starting to get better over time. If it lasts more than 2 or 3 days, it's probably colonized or infected. So if you have a pink rash with tiny little pinpoint dots around it, those are called satellite lesions, and that is a Candida infection. So Candida is a yeast or a fungus that grows on the skin. You can try something like apple cider vinegar and water 1-to-1, dab that on 3 times a day, and vinegar is antifungal, so it should kill it. They will smell like a salad, but it can help. You can also use something over the counter, like a ringworm cream or an antifungal cream over the counter. Those can sometimes help. And if those aren't enough, then you can ask your doctor for a prescription for nystatin. And nystatin is an antifungal prescription cream that's super safe to use in the diaper area. If your baby tends to spit up and they have a little bit of a drool rash on their chin, or they have the rash in the folds of their neck with those little pinpoint dots around it, you can try the same things as well, because it might also be colonized. It's the same process as a diaper rash. So start off with things like a zinc-based ointment or a petroleum-based one to use as a barrier on their skin folds or on their chin if they're drooling. Sometimes that's enough to make it go away, but if not, you can try an antifungal cream. With diaper rashes that have little boils or pimples in them, typically that is a bacterial infection, usually staphylococcus. Something like MRSA is super common. And MRSA is just a special kind of staph. It doesn't get killed by normal antibiotics. So if you want to try at home, you can start off with Neosporin 3 times a day. That's over the counter. But if that doesn't help, you might need a prescription strength ointment called mupirocin. And mupirocin is something that will kill staph. I recommend treating the whole family if it happens more than once, because staph can live inside of your nose and under your nails. So the way that you treat it is you put a little bit on your fingertip, smear it inside of both of your nostrils 3 times per day, and then put a little bit under each of your nails 3 times per day for everyone in the house for 10 days. And that will eradicate it from the house and should prevent it from coming back again. If it's happening because your baby's at daycare or preschool or has a babysitter, you want to treat them as well, or just, request that they be treated. You can't force anyone to get treated, but if it's happening multiple times, I usually recommend treating the staff that are changing diapers, or they can use gloves, plastic gloves when they change diapers, and that should help. Your checkup at 1 month of age, your baby should have gained about 2 pounds from their birth weight. And that's based on the average 7-pound baby. So give or take, but isn't that crazy? So 2 pounds or 1 kilo up from their birth weight at a month of age. For neuro and development, we're still looking for that grasp reflex, which is where you touch their palm and their fingers curl down, where you touch the pad of their foot and their toes curl down. The rooting and sucking reflexes should still be there, and the moro reflex. Now, babies should calm down when they hear your voice at this age, or when you do calming actions like swaying with them or wrapping them in a blanket or holding them close. They should be starting to follow you with their eyes. And this is really cool to see them doing. So you'll notice that they fixate on your face. And then as you move, they can follow you. They usually can't follow past midline. So they can only, follow about half of their vision, their field of vision, but it's really fun to see. They'll also start to recognize familiar voices, and you'll see them light up when they hear their mom or their dad or their siblings talking. They can communicate their needs, and they'll start to have different cries for when they're hungry and when they need to be changed. And they should be lifting their head when they're laying in tummy time or when they're on your chest. Remember that the fontanelles, which are the soft spots on babies' heads, should be open until about a year of age. So you will still notice that they have a soft spot on the front of their head at this age. If they had one on the back of their head, that's the posterior fontanelle. Sometimes that closes at birth, typically closes within the first 6 weeks of age. So it should be closing if it hasn't already. And your anticipatory guidance we're going to do at this age. So baby, remember, should only be eating breast milk or formula for the first 4 to 6 months of age. They don't need anything else. No water, no juice, no foods, nothing else, just breast milk or formula for 4 to 6 months. They should be taking vitamin D supplements, 400 units per day, or mom can take 6,400 units if she's breastfeeding, and that will put 400 units into the breast milk. Babies who are formula fed are typically getting 400 units with their formula at this age. So a lot of times they don't need that extra supplementation. Mom should be eating a wide variety of foods and taking a prenatal vitamin while breastfeeding. You don't need to cut anything out while you're breastfeeding unless your doctor has told you to. And typically that's just if your baby has an allergy. And allergies in newborns will look like either very severe eczema or blood in the stools. For sleep, your baby should still be placed on their back to sleep every time. If you put them on their sides, sometimes they will flop onto their stomachs at a month of age and they can suffocate. And so sleeping on their side is a risk factor for SIDS. So you want them flat on their back. If they get themselves to their side, that's fine because usually they can't get themselves far enough to flip over. No blankets at this age. You can stop swaddling if you're still swaddling at this age. Sleep sacks are okay and they are safe because they zip to your baby's body and they won't get tangled in it. Remember the ABCs of sleep. They should be alone, on their back, in a crib or bassinet. You want to try starting to put baby down when they're awake but drowsy at this age, not fully asleep, so that they can get used to sort of soothing themselves a little bit and helping themselves to fall asleep. Remember, a fever is still one of the most dangerous things in a baby, and a 1-month-old does not have a fully developed immune system. So if they get a fever, it usually means they're pretty sick. Anything over 100.4 degrees Fahrenheit or 38 Celsius is considered a fever. The best way to take a temperature is with a rectal thermometer. You only want to put it in far enough for that silver probe to go inside. So it's only about 1/4 of an inch in. It's not very far. You can also use a temporal artery thermometer, and that's one that scans across the forehead all the way into the hairline. The ones that are infrared thermometers that you just point it at the forehead and kind of click the thing, it looks a little bit like a scanning gun at a supermarket. Those ones are not super accurate. If you are using it, just scan everyone, in the house at the same time and make sure they're all approximately equal. But those are pretty inaccurate. They tend to give you more of a skin temperature and they depend on room temperature as well. And also things like sunlight can affect those. So I don't recommend the infrared ones. Also, temperatures under the arm are skin temperatures. It's not a core temperature. And those can read off either high or low from their actual body temperature. So I don't recommend under the arms. So and in the mouth, they're too young to be putting thermometers in their mouth. So the best way to take a temp is with a rectal thermometer or a temporal artery thermometer at this age. Remember that you should never leave your baby alone on any high surfaces. They can wiggle and scoot off the edges of things very quickly, and they can do that before they can roll or crawl. So I see a lot of babies around a month of age. Parents are thinking, okay, they basically don't move when I set them down. So they'll set them down on the bed while they're getting changed, or they'll set them on the couch or something. And babies will fall off of these surfaces a lot at this age, especially. So please don't ever leave your baby on one of these surfaces unless you have your arm on top of them and you're touching them the whole time. Changing tables as well are another risk factor. They should be in a rear-facing car seat until they're 2 years old or until they outgrow the car seat so they can stay later than 2 years of age. It's actually safer because their heads are pretty big, their necks are pretty short and weak. And so when you hit the brakes, if baby's head is going back, it's just cradled by the car seat and doesn't go very far. But if they're facing forward, they get pretty bad whiplash because their head will go forward, and they can't even die from that. So rear facing car seat as long as possible, but at least until age 2. When they're buckled in that car seat, you don't want any blankets underneath the buckles, no thick coats or jackets or anything puffy, because those will make you not able to tighten it as much as you need to. It should be tight enough that if you took that car seat and flipped it upside down, your baby would not fall out. Do not try this, don't practice it, but it should be that tight. And if you can take your fingers and pinch those straps and they pinch together, it's too loose. You need to make it a little tighter. You want to still avoid secondhand smoke at this age. Remember that secondhand smoke is one of the highest risk factors for SIDS or sudden infant death syndrome in babies. If family members are smoking, please step outside to smoke and then change your clothes and wash your hands with soap and water before holding baby. And that's the best way to reduce smoke exposure to your baby. Of course, quitting is the very best way, or at least cutting back can help as well. If you're not able to do that, I get it. It's okay. Just try to, go outside, try to avoid that exposure to your baby. You should be bathing your baby about once or twice per week. And at this age, we start recommending that you set your water temperature of your boiler to 120 degrees Fahrenheit or less to avoid scald burns. Sometimes babies will be, bathing in the sink at this age. And if the water's running and say someone, flushes a toilet in the house, for example, sometimes that water will get scalding hot. So if your boiler is set to 120 degrees, that temperature is low enough that it takes a second or so for them to pull their hand out or to pull their body away. And they do have time to pull away from that water before getting severely scalded by it. So 120 degrees. And then for skincare at this age, usually they're not peeling so much anymore. You can still use baby lotion or ointment or cream after your baths once or twice a week if you need to. And you should still be doing tummy time. Tummy time at this age should be half an hour twice a day on a blanket on the floor. Your next checkup's going to be when baby is 2 months old. So another whole month. That's their whole lifespan already, right? So what's going to happen before then, or things you should get ready for? First of all, this is the time to buy some children's or infants' Tylenol, or acetaminophen is the generic of that. Children's and infants in the US are both the same concentration. It's just infants comes with a syringe and the children's comes with a little cup for them to drink it out of. So the infants is a lot more expensive. So if you have a syringe at home, just get the children's. But anyway, Tylenol or acetaminophen is the one that you want. They cannot have ibuprofen yet. And ibuprofen is also known as Motrin and Advil. So not yet for those. Those are at 6 months of age. So for your 2-month-old visit, they are going to get their first round of vaccines. You don't need to pre-medicate, and I don't recommend pre-medicating before the visit. Just have that Tylenol on hand in case they get a fever and they need it. But your first round of vaccines, we're going to give DTaP, which is diphtheria, tetanus, pertussis, polio, Haemophilus influenza B, which is a bacterial infection, Hep B vaccine, should be their second dose. The PCV, which is pneumococcal vaccine, it's 13 kinds of strep, and it's the kind of strep that goes into your bloodstream and your lungs. It causes pneumonia, sepsis, and can get into the brain and cause meningitis. So it's the worst kinds of strep. And then the rotavirus vaccine, which is oral. So I know that sounds like a lot, but typically there will be 5 or 6 of these in one needle. So baby's either going to get, so the PCV vaccine is by itself, that's in its own needle, but then they're either going to get another 1 or 2 needles. So either 2 or 3 shots at this visit and 1 oral vaccine. That's the rotavirus vaccine. So that's by mouth, and that's just a little syrup that they drink down. Most babies don't have any problems with their first round of shots, which is why I don't recommend pre-medicating. A lot of them don't even get a fever or fussy or a lump in their leg, but they might get some of those things. So your doctor will tell you what to do, and ask your doctor at the 2-month visit what their dose of Tylenol is going to be, because they're going to be heavier than they are now at the 1 month. So you're going to need an updated dose for Tylenol. You're going to also expect their pooping to consolidate a little bit more. Right now, the rule of 7s is that anything from once a week to 7 times a day is considered a normal frequency for poops. So anything in there is fine. If it's been more than 7 days, you can call your doctor's office and they can give you some tips to help baby poop at that time. But really, we don't get worried until it's like 10 to 14 days. It's just around that 7-day mark is where they're probably getting uncomfortable, and we can give you some tips. They should still be peeing every time that they eat at this age. So that's about 8 to 10 times per day on average. And you still need to wake them up if they've been sleeping for 4 hours so that they can eat something. Sometimes it's okay to let them go 6 hours. Ask your doctor at that 1 month visit if they're allowed to go more than 4 hours yet. Sometimes we need to wait until they're 2 months old. So that's it. Your baby's a month. You made it. Now for the next month, I think you've got this under control. Go back and listen to this if you need to again. And we will see you for their next checkup when they're 2 months old. So look for that episode out next. Thank you for listening to the Baby Manual podcast. Please hit that subscribe button below so you don't miss the new episodes when they come out. I would also love it if you could leave me a review. If you'd like to buy a copy of the Baby Manual, it's on Amazon and Kindle. I'm the author, Dr. Carole Keim, and that's spelled Keim. You can also follow me on YouTube, TikTok, Instagram, or Facebook to get some quick baby tips that will make you feel like an expert. Thanks for listening.